The kettle was already cold by the time I remembered I'd put it on. That's the thing about house calls. You step into someone else's world, and somehow your own sense of time just dissolves. You forget you were thirsty. You forget your feet hurt. You forget everything except the person in front of you and whatever it is they need. This particular evening, what they needed was me, a small bag of supplies, and apparently the patience of someone who had nowhere else to be. His name was Daniel, a friend of a friend, the kind of introduction that comes with a text at 8 in the evening that says, "Hey, I know this is a lot to ask, but my neighbor is kind of freaking out, and his doctor is 3 states away, and I thought maybe you could just stop by?" I almost said no. I had tea going, I had a book I was actually enjoying for once, and then I thought about someone sitting alone in an apartment, scared, and I put my coat back on. He opened the door before I even knocked. Must have been watching through the peephole, which, honestly, I respect. Situational awareness is underrated. He was tall, broad-shouldered in the way that makes you think construction or a former athlete, except his eyes had that particular quality of someone who had not slept well in several days. Dark circles, a little hollowed out. He was holding his own wrist, pressing 2 fingers to his pulse like he was checking it for the 4th time that hour. "You're the nurse?" he said. "I am," I said. "And you're the one who's been taking his own pulse every 15 minutes. He looked down at his hand like it had betrayed him. "Is that bad?" "It's very human," I said, and stepped inside. The apartment was clean, warmer than I expected. There was a half-eaten bowl of something on the coffee table and a phone with the screen cracked in one corner. The kind of crack that happens when you drop it in a hurry, not when you throw it. Important distinction. He'd been prescribed an intramuscular injection, a vitamin B12 complex, high dose, the kind a doctor orders when someone's been running on empty for too long and their body has finally decided to file a formal complaint. His regular nurse was unavailable. His doctor was, as mentioned, 3 states away. And Daniel, despite being a grown man who had presumably survived many difficult things, was deeply, sincerely afraid of needles. "I know it's ridiculous," he said, sitting down on the edge of the couch. "I know it doesn't even really hurt that much. It's not ridiculous," I said. I was already washing my hands at his kitchen sink, which was spotless, which I noted with quiet approval. Fear isn't logical. That's what makes it fear. He was quiet for a moment. "Does that work on all your patients?" "Only the ones who are secretly a little charming about it," I said, and I didn't look at him when I said it, because sometimes that's the kindest way to give someone a compliment. Sideways, like you're not quite meaning to. I set my bag on the kitchen table and started laying things out. Gloves, alcohol swab, the syringe, already prepared and capped, a small gauze square. I do this slowly, deliberately, not because I'm stalling, but because I've learned that watching someone prepare with calm hands is its own kind of medicine. Anxiety lives in uncertainty. When you move like you know exactly what you're doing, some of that uncertainty just lifts. "Okay," I said. "I'm going to do this in your upper outer thigh. It's the most practical site for self-administration, too, which is useful if you ever need to do this yourself. But for today, I've got you." He made a sound that was almost a laugh. Upper outer thigh. I know, very glamorous location. You're enjoying this. I enjoy my work, I said simply. That's different. He rolled up the leg of his sweatpants, cooperative, which I appreciated. I pulled on my gloves. The latex is cool at first, a little tight, and then it warms to your hands and becomes almost like a second skin. I've done this so many times that the snap of the glove is almost meditative to me now. I found the site by feel as much as by sight. The vastus lateralis, the outer thigh muscle, thick and forgiving. Good blood supply. Predictable. I pressed gently with 2 fingers to confirm the muscle mass, to feel that there was enough there to work with. His muscle was tense. Of course it was. He was nervous. So I talked. Try to let that leg go heavy, I said, like it's not attached to you, like it belongs to the couch. That's a strange thing to imagine. Strange things work, I said. Think about the last time you were really, completely relaxed, somewhere warm. Beach, he said after a second. My parents' place. There's a porch. Good. Stay there. I felt the muscle soften just slightly. That's the moment. You wait for it. That small release of trust when the body decides, okay, maybe this is safe. You don't rush it. You can't rush it. And when it comes, you move. The angle for intramuscular injection is 90 degrees, straight in, perpendicular to the skin, not angled like subcutaneous, straight, confident. Hesitation makes it worse, always. I've seen nurses, good nurses, careful nurses, flinch at the last second, and that half second of doubt translates directly into the patient's experience. So you commit, you breathe out, you go. He barely reacted. I aspirated briefly, a habit, a check, and then delivered the medication slowly, steadily. The rule is 1 milliliter per 10 seconds, roughly. Not a race. The muscle needs time to accept the volume without cramping. I kept my voice going the whole time, not saying anything in particular, just keeping the sound of something calm in the room. Almost done, I said. You're doing great. I haven't done anything, he said. You stayed still and you breathed. That's everything, actually. I withdrew the needle at the same angle I'd entered, straight out, clean, and pressed the gauze down immediately. Light pressure, a few seconds. No rubbing. Rubbing irritates the tissue and can cause bruising. Just hold. Done, I said. He turned to look at me like he wasn't sure he'd heard correctly. That's it? That's it. I've been dreading that for 2 days. I know, I said. Most of the pain of a needle is anticipation. The actual event is usually anticlimactic. He laughed then, a real one, surprised out of him, and I found myself smiling too, disposing of the syringe safely in the small sharps container I always carry, peeling off my gloves with that familiar inside-out technique that keeps everything contained. I told him a few things before I left. That B12 injections sometimes cause a mild warmth or flush, normal, not alarming. That if he felt any unusual soreness at the site after a day or two, a warm compress for 15 minutes would help the muscle absorb the remaining depot. And that the fatigue he'd been feeling, the bone-deep kind that sleep doesn't fix, that was the deficiency talking, and it would take a few weeks of treatment before he'd feel meaningfully different. Don't expect to wake up tomorrow feeling like a new person, I said. Expect to wake up tomorrow feeling like yourself, just with a little more in the tank. He walked me to the door. His pulse, I noticed, was no longer something he seemed to be monitoring. Can I ask you something? He said. You can ask, I said. Do you actually like doing this? House calls, I mean. Strangers calling you at night? I thought about it honestly, the way the question deserved. I like the moment, I said, when someone who was scared isn't scared anymore. That's